Cool. Well, my name is John Seeley. I'm going to go over some orthopedic supplies, medical equipment that is used in the hospital in different facilities, orthopedics, the ED, also in surgery. First thing I'm going to start with is walking boots. Walking boots, we have 4 different options here that we stock in all different locations. The tall boots here, there's 2 different products. One is the Max Trax, which is a metal upright on the sides. Then we have the Aircast, which is a full enclosed plastic boot to give a little bit more stability and comfort to the patient. I'm going to show you how these each go on. I'm going to start with the Max Trax because that is probably the one that involves a little bit more, mostly because on the Aircast you have 3 straps and on the Max Trax you have 5. So I'm first just going to undo all the straps. I just took all these products out of a bag today, right now before this, so this is how they will come out. I did just remove the packaging insert, which has the instructions for use, which should go home with the patient. There will be 4 little pads inside the Max Trax, the tall and the shorter version, the ankle version. I'll show you what those can be used for here shortly. I'm just going to set them aside. So the first thing I do is I take after undoing all the straps, I'm going to remove the liner. So you don't need to do this on the Aircast boot, but on this one you do in order to fit it correctly. So one thing I want to point out is these white upright cloth things here, I'm going to leave those on the uprights, and I'll show you why in a few minutes. So I'm going to set that aside. So first thing I'm going to do is open this up, the liner, and I'm going to have the patient, who's Candy here, is going to assist me. I'm going to use your right leg. So I'm going to have her lift her leg up. Of course, I understand if the patient's in surgery, they're not going to be doing this for you, so you could do this bedside or with the patient, not awake. There are 2 little Velcro tabs, so I'm just sliding her heel all the way back, and then I'm Velcroing closed the liner. The reason I want to do that is if I were to take this out of the bag with the upright in it, it's just going to sit wherever it was with when they put it in manufacturing. What I want to make sure is when I put this on the patient, I want to make sure these uprights are right in the midline of her shin. So I like to hold this apart, and that's one reason we have these white cloth pull strips here, is because there is Velcro on the inside that's going to catch the liner and keep it from sliding around. So these are something we'll remove here shortly. So what I'm going to do is I'm going to hold this open, allow her to lift her foot up and slide her heel all the way to the back of the boot. Go ahead and slide back for me. So we want to make sure she's pushed all the way back. I didn't talk about size selection, but these are unisex, so they will fit a male or female, left or right foot. You want to make sure when you're putting it on somebody, basically just like a tennis shoe, you have a little bit of space in the front of their toe. You don't want it overhanging too much. You don't want the toe overhanging, but you also don't want the boot way too long because that will cause a trip hazard. So when she's pushed all the way to the back, I want to make sure I don't have any gapping back there. If I do, I'm going to push her back a little bit more. I will then start Velcroing up the foot straps. The top or the bottom foot strap here just goes right directly across the top of her foot. Then we have 2 ankle straps. Some people prefer to do those straight across as well. I actually like to cross them in the front of the ankle like this. I feel like that kind of just gets it out of the crease of the ankle a little bit more and does provide a little bit more push posterior on the patient to keep their heel locked back. Then what I do before I untangle. Before I do the straps here, I can adjust where the straps are in the little slits, up or down. I just want to space them out on her leg. Then I will continue on with those 2 shin straps. After I have those done, and I kind of did this without telling you, but basically I want to make sure that upright is in the midline of her shin. Then what I'll do, I'm going to have you bend your knee. I'm just going to pull these up and dispose of them. I'm actually not going to take them off now, but basically just rip them up and toss them. If you don't remove these, it looks silly because they are meant to be disposed of. But once that's done, you pull those up, the liner will Velcro inside to the upright, as well as those straps aren't going to slide around within the slits anymore. They'll be Velcroed on the outside on the boot. The next thing is we can instruct the patient how to inflate the air cells. So on this walking boot, there's 2 air cells that go posterior around to the lateral and medial side of the heel. We can inflate this. When I do this, it's inflating both of them the same amount. So this is not something that's going to provide compression as much as just fill some space, some gapping, provide slight compression, but I want to make sure the patient knows you don't want to overinflate this because you can't pop that bladder just like you can a balloon if you overinflate it. If it gets too much, if you do too much, there's a depress valve here that I can push and that will let the air out. So again, not meant to be really significant compression, just slight filling some space and giving slight compression. And again, I did not do this, but I would take off and remove these to dispose of them. The other products, so walking boot wise, I'll show you the Aircast in a second, but to go to the ankle version, the difference of what I've seen practitioners use, they will typically use the taller boots on somebody who has an ankle or a lower shin injury. The shorter or ankle version of the walking boot, typically that's a 4-foot issue, something that's not as involved, or maybe they might have something in the ankle, but not as big a deal as something that would require a more immobilization. So anything with the walking boots, the taller, the bigger, the more stabilization you're going to get. This would go on the same way, except for there's only 4 straps. I won't pull that out. But I want to show you that these 4 pads that do come with each boot, I typically don't use them, but you can use them to do some padding in between to fill some spaces, as well as you'll see there's some slits on side here. You can actually put the straps, intertwine those, and help those if you want to put some more padding across the top of the foot or in the crease of the ankle. Otherwise, you could just put those back in the packaging with the instructions for use, and the patient goes home with them, and they'll probably just be discarded down the road. The tall version of the Aircast and the ankle version of the Aircast, the difference is, as you can tell, it's a plastic, fully encompassed upright versus having metal. These are plastic infused or metal infused plastic single uprights there on the sides. I'm going to unvelcro these. I find this one a lot quicker, easier to fit. 1, I don't have to take off as many straps, and then 2, I don't have to take the liner out. So you will get a sock, a tubular sock in the Aircast tall version. This is something patients do want to wear a sock when they wear a walking boot. If they do, I get it in surgical conditions, that's no big deal if they're going home without a sock or something. But when they are up and mobile, when they get home, having that sock does help the boot from getting pretty nasty over time of the sweat and skin cells. That way they can change their sock and the boot doesn't absorb all that. The upright here, the front anterior shell comes off, and then you have the liner portion on the front of the foot on Velcros. You could see, it may not be easy, but basically on the anterior shell, there's a pre-inflated black bladder on the anterior portion. That will stay. You don't undo, or that just comes pre-inflated. But there's also 3 bladders on this one on the posterior shell, 1 on the medial or lateral side, another on the opposite, and then 1 posterior. So when we go to putting this on, I'll show you how to select which air chamber we're going to fill. They are marked. So again, the anterior shell, you don't have to adjust, that it's not adjustable, but they are marked air chamber 1, 2, and 3. And we have a dial to select which air chamber we're going to be inflating. So I would select air chamber 1, I would inflate, I would go to 2, inflate, and finish up on 3. The reason you want to finish up on 3 is you don't want to inflate that too much, push the patient too far anterior in the boot. That's why it would come last. The last step would be to lock it, which would hold the air in all those air cells. I'm not sure if you can see, but there's basically a little lock symbol, and that just holds the air. To deflate, same thing. There's a depress or a valve here that to depress, but you do need to select what chamber you want to allow that air to come out of. So putting the walking boot on is the same. I won't go through the whole thing, but basically the same type of thing with Candy. She's going to lift her ankle up, slide her heel all the way to the back, and then I'm going to close the 3 little pads in the front. With this boot, there are some little tricks. So you'll see these little wings on the shin portion and on the foot portion. So on the foot portion, I'm going to insert that inside to Velcro the strap. I can't do it on the outside because the strap won't allow me to do that. So that's kind of a no-brainer. But where people get tripped up is on the shin portion. Again, I'm just pushing back, Velcroing that strap. But on the shin portion, I don't want to put these tabs on the inside so they dig into her. Those can go on the outside. We prefer those to be on the outside so they don't dig in. So again, 2 more straps here, one on the lower shin, one on the upper shin. Inflate through your 3 air chambers, and then patient can ambulate. When a patient's ambulating in a walking boot, you want to make sure that they are educated on how to step down first. So they want to hit their heel, glide through, and off on their toe. So basically, you don't want them to walk around peg-legged. They should be able to hit their foot, their heel, glide through mid-stance, and off on their toe. It will be a little bit more, it doesn't look as smooth as normally like in a tennis shoe, but the more they do it, the more it will feel normal to them and appear more normal in gait. So walking boot wise, again, there's a shorter version here. This one, we have the anterior shell. The air bladders are on each side. So on the shorter version, there's actually 3 air chambers, one on the anterior shell that's pre-inflated, non-adjustable, and then you have 2, one with a bulb and a release valve on each side. So you don't have a dial to turn like you do on the tall version. The next thing I'll go over, staying in the foot and ankle portion of products, thank you, are a post-op shoe and a wedge shoe. So this is a 4-foot wedge shoe and a post-op shoe. What you're probably going to see most of is a post-op shoe. Wedge shoes are very specific. I'll go over that in a second. Again, these are unisex, so fits male or female, and it will fit a left or right foot. Again, these are sized more so of where the toes lie in the once the patient's in here. You don't want them overhanging so their toes are overhanging, and you don't want them way too far back so the toe bed is too long that they're going to trip when they start ambulating. So very simple to put this on. Velcro strap on the front. I'm going to pull this off and show you. There's a little piece of Velcro here on the inside of, or on this strap here, and I'll show you why that is. It's because this material is so long. We do have hook Velcro at the end here, but usually that's going to be so long that you're not going to be able to use that. That's why we include this little piece here. So unless the patient has substantial bandages where they're going to have so much bulk that this strap stays so far long, usually it'll be a little bit tighter. So this strap is also removable on the foot to accommodate that dressing, bulky dressings if they have any post-op dressings. So patient, again, I guessed on mediums for Candy today, and I guessed well. So she's going to slide her heel back, Velcro that closed. If I want, I can take this off and adjust that. So again, if she had a lot of bulky dressings, I could make that a little bit looser, and it gives me more material. And then the long strap here goes across the 4-foot or crease of the ankle. Now, you'll see with her being in this is really not going to come where that Velcro does much for me here. So that's why we have this little piece that I pulled aside. That could set right there and help hold that strap. Now I could trim this strap. You could cut it straight across or round it on the edges like it is here, but that way it doesn't dangle or stick around. And then you can move this down closer to the end. If I were to cut that off, pretend here, let's say that was cut off there, it would end right where that Velcro is. So that is pretty simple to put on the walking or the post-op shoe. the difference in the post-op shoe, I'll let you take that off, and the forefoot shoe, the offloading forefoot shoe. Very similar strap on the foot, same strap across the top of the ankle. The difference is how you have material cut away on the forefoot. This would be somebody who has more, could have a wound on their forefoot that they want to offload where the pressure is going through the heel or midfoot, but not on the plantar surface of the distal foot. Could be somebody that they did a surgical procedure that they want to take that pressure off too. I do see it mostly in wound care or wound use, but might be some practitioners that use it for other procedures as well. So it goes on the same way, just looks a little bit different. The bottom of the foot, but the strappings work similar and same way. All right. Next products I'm going to go over are I'll just go over real quick wrist braces. So I brought two different options of wrist braces. We have a wrist brace, and then we have a wrist brace with thumb orthoses. So on the boxes, let me grab those real quick to show you. A lot of people get confused because they are both called the Quick Fit wrist brace. So, but one has Quick Fit WTO, which stands for with thumb orthoses. The other one that's just a Quick Fit wrist 2, that's just a typical wrist brace without a thumb included. So with these, they come in 4 different sizes. You have a left, you have a right, and there's 2 sizes in each. There's a universal size and then a universal extra large. What the extra large versions do is just give you your straps a little bit more length, as well as the base of the whole product of the brace is a little bit bigger. So if somebody has a wider wrist, that's where you'd be able to use that, the extra large version, as opposed to just the true universal. So with this, I'm going to open up. These are both rights. Can you come up this way a little bit just so be a little bit closer? So these are both rights. You're going to see that there's a little crease here that has a little contour. That's going to go on the palmar side of their wrist. So if you ever forget, they are marked as well, but if somebody rips the tag out, you can always look and see where that palmar stay is. That is also removable. Not that people do this, but you can unvelcro and take that stay out if you have somebody who's not allowed to have metal in the brace. Or if you wanted to bend that, you could bend it while it's in here, or you could take it out and adjust it. But I'm going to have Candy slide her hand in here. Now, what I'm going to do is there's a thumb strap, so I'm going to make sure that I have this position, that crease, or that contour of the wrist brace right at the base of her wrist. And then I'm going to Velcro the thumb strap closed. Now, why we can use a universal size is we have the elastic strap to tighten up or loosen on somebody who's got a bigger arm. This Velcros across. One other thing I'll point out before I do that is there is an adjustable stay as well on here. So this has a metal stay in it. So again, if you have somebody who you have to take off metal for, somebody Department of Corrections or something, this just gets taken off. The stay on the palmar side gets taken out. This is also positionable. You can put it wherever you want on the lateral side. Usually it's going to fall right on the lateral upper side there. And then that Velcros across. The only difference on the product for the wrist with thumb orthoses has a same strapping mechanism. The thumb, though, is included. So instead of having just the thumb cut out here, that's going to actually stabilize her thumb a little bit more so she cannot flex, extend, abduct, adduct. And that goes on just the same way. And then you just have the Velcro strap to close it across the thumb web space. So those are wrist braces and wrist with thumb orthoses. Next thing I want to talk about are slings. So slings, and we have an ultra sling, which is a little bit more involved, has a abduction pillow, and then this is a shoulder immobilizer. So the difference in what an actual sling, if this were a true sling, you would have one strap that goes across the patient's neck. This waist strap would not be here. That strap is going to go around her waist and stop her from moving or abducting her arm. So that's going to immobilize her more so, which is why it's called a shoulder immobilizer. So I'm going to try to stay out of the camera, but with any sling, what we're looking for is I want to make sure that when I put the sling on, I have the sling go all the way from her elbow or olecranon all the way to her MCP joint. A lot of people I see will have a sling on that's too short. Again, this is a medium, so I was guessing Candy would be a medium. That would be correct. So I'm not sure if you could see, but basically I want to make sure that sling is basically out to her MCP joint. I'm going to pretend, but let's say the sling had ended here. That would be too short for her. That's going to allow her wrist just to dangle, cause some nerve issues of her when she ulnar deviates. So what I'm going to do is slide her arm in, elbow all the way to the back. And then I'm going to take the one strap across her shoulder, and that's going to go through the little ring here. With a shoulder mobilizer like this, again, I'm going to slide her all the way to the back. You want to use the shoulder strap and the waist strap. The waist strap comes around like so, and I'm going to undo this because I like the Velcro on the outer portion. So I'm going to insert this back in so I can adjust it as opposed to that being towards her body. I can't adjust it as well. All right, so back in here. So that is a comfort thing where you want to, too many arms. You want to basically do it snug but not restrictive. With the shoulder strap, there is a pad that is not going to be in the right position, so you'll have to adjust that. There's a pad that just slides on the strap. I'm going to turn you this way. And that will be a little bit more, take a little bit pressure off the neck more. So biggest thing, have their arm all the way slid back, and then also have the elbow at 90 degrees. Now, I'm going to exaggerate and loosen this some. Go ahead and relax. So here, Candy's basically her elbow is at a greater angle. I want to pull that up a little bit more because she's going to get swelling that's going to sit in her fingers. It's not also not immobilizing her shoulder as well. So I can tighten this up here a little bit more. I can also take some of the extra slack out of the back of the back side of the strap. If I get where this shoulder pad is in the way of that, I can move it out of the way. Tighten this a little bit more, and then move that back. But I don't want to go less than the 90-degree angle, so I don't want her crazy bent up like this. That will cause some irritation on her nerve in her elbow, but roughly 90 degrees is where we want the patient. Covering all the way to the MCP joint so their arm does not ulnar deviate. Their hand does not ulnar deviate. That is how to put that shoulder mobilizer on. There is, I'm going to show you also in here, I don't prefer this, but some people do. This is a little loop that you can slide your thumb into to help you keep your elbow slid back to the back of the sling. Some people like that. Some people it drives them nuts. So to each his own. But to take it off, again, just two straps, one on the shoulder and one on the waist. Putting on the ultra sling, which is typically used in a more post-operative rotator cuff, slap tear, anything like that, labral repair. I like to take the sling all the way off. Again, I didn't talk about this, but sizing. These are universal on left and right, but they are sized. So we have on the shoulder mobilizer, they go all the way, I believe, to like double extra small up to extra large. On the ultra sling, extra small to extra large. The sling, I like to take that off first. I like to position the abduction pillow first. I'm going to leave this big Velcro strap here on the pillow, but I'm going to point out that this is removable, that if I happen to pull this off real fast and it's stuck to the sling here, that is fine. We'll put it back on when we go to putting the sling against the pillow, but I do typically like that to be right on the sling pillow itself. So I'm going to undo the buckle on the waist, and I'm going to loosen this up as far as I can. It is easier, in my opinion, to make the brace tighter on somebody than it is to loosen it while it's on them. So I like to make it really big. I know that Candy's not going to need that much room, but I like to then, I'll use her right elbow as well. I'm going to position this on the side right above her hip. And again, this is going on the side. This is not something we put on her front of her belly or just slightly off laterally. That actually goes all the way over to the side of the hip, unless the physician tells you differently. Has a buckle that clicks in here. And now I can adjust this on either end. I don't like to go crazy and adjust on the anterior portion because I want that to be reachable for the patient. If that's a word, reachable. Something they can reach to adjust down the road if they need to tighten that later. What I like to do is take all that extra slack out of the backside. The other thing with this back strap is, this is a removable, so I call this like an alligator tab, Velcro alligator tab. I'm going to set that aside so I can actually take this off. I can cut extra material off. We do have little sewn straps here. I actually think they're way too short, but that way it doesn't fray at the end. But really, you could also fold it up. I'm going to pretend I cut that. That's gone. I'm going to put this back on, and then that way that strap Velcros like so. Next thing I'll do is I'm going to go to the sling portion. I did not measure this on her. Again, this is a medium, but I'm going to guess that she's pretty darn close to a medium here. Yep. All right, so this has the strap tucked inside. This strap has two buckles on the front portion of the sling as opposed to just one that goes through the strap. So I'm going to unbuckle both of those. And then what I'm going to do is I like to leave this strap that goes across the top of her forearm on the inside portion of the sling. If I put it on here like this, that way it's going to interfere every time she tries to put it on it and she can't tuck it through into the pillow. So I like that to be on the inside portion. Then what I'll do is I'll have this strap, I'm just going to undo and set off so that loop stays there. So I'm going to have her slide her elbow all the way to the back of the sling. And then I'm going to position her where I want her in. I'm going to Velcro that closed. I want her in a neutral rotation. So I don't want her in internal or external rotation. And that's why we have that pillow on the side. I want her basically off to the side, shoot it, with her arm or hand pointing straight out. If she were rotated inward, that would be internal rotation. That pillow way on her back, that would be external rotation. This strap here, just like the thumb strap on the shoulder mobilizer, some people prefer it, some don't. If you do prefer this, again, because that sling is going to be over there, I like to tuck, or that pillow is going to be over there, I like to tuck this in and then use that. That also helps keep the patient pushed back in the back of the sling. We have the two buckles here, so I'm going to take this strap over her shoulder. And one thing I do while I'm doing this is I'm actually going to take this portion, this Velcro part here, I'm going to loosen it all the way so that ring ends up right at the bottom of where that Velcros. Same thing with the strap on the front there. I don't want to adjust the Velcro on the front side with the patient. I'll take all the adjustments out of the back because we do have that alligator tab as well. So that's going to go around her neck. This is going to be really long right now, but we have two buckles. The reason we have two buckles there as opposed to just a single, this allows the patient to stay in the sling. If they were going to do external rotation exercises, they can unclip one of the buckles, the outer buckle. That sling would be still supporting them. They could undo that strap and they can work on external rotation exercises. Of course, they would undo the strap here too. That is something that's why that's designed. In real world, I don't see that happen a lot, but that is why it does have two buckles. So what I'll do on the back side, I'm going to adjust, take all that extra material out. The pad here, the shoulder pad, I'll slide that up. And then again, I could use scissors and take out the extra amount of material on the strap. You will notice that these straps are really long. Don't be afraid and think I'm cutting too much. Usually I'll take at least a foot off because it's usually too long on somebody. We do make them extra long for that reason, that they will fit every type of body type. Same thing with the waist straps. So I'm just going to pretend again that I cut that. I'm going to put the Y tab back on, or the alligator tab back on, and Velcro that. But that allows me to make minor adjustments on the front portion, on the anterior portion. So again, I want her elbow at 90 degrees. So if I need to, I can adjust this and pull this tighter, but I don't like to go crazy when I'm initially fitting the patient, and I don't want that strap to end up way up here. I want, when I'm done fitting it, sorry, Candy, I want it to end up right about there. So she has that adjustability down the road as opposed to trying to reach over the top of her other shoulder. So that's why I like to take all the extra slack out of the back strap. And that is how to take on and off the ultra sling. Or put on the ultra sling. To take it off, we just go in the opposite. We have 2 buckles on the sling, 1 on the waist strap. The buckles, if you notice, they are different. So you'll have 2 different buckle systems, so you can't screw up which one goes where. And then just a strap across the top of the forearm and web space. Last thing I'll show you is there is a ball on here that this is removable, and the Velcro comes off, so you can stick this anywhere you want on the sling, but the ball is also comes out. This is more not necessarily for strength, but more to get circulation in the fingers and the palm. So the physician may have the patient squeeze that every once in a while, every few hours, to help with swelling. All right. So that is how to put on the ultra sling. And I'm going to take a little break here to get a table so she could do for knee immobilizers and stuff. So I don't know if you want to stop or turn this off or saves your battery.